we're seeing nowadays is a crisis of sperm health and fertility rates around the world.
For anybody watching this and they're curious, what is male factor infertility? What are some examples of things that could happen?
Most people, when they think about infertility, unfortunately think it's the female problem and that it's all the women's thought. And what we know is that's not the truth, that over 50% of times that a couple is having difficulty with fertility, the male is involved to some degree. And that has to do with sperm health. And what we're seeing nowadays is a crisis of sperm health and fertility rates around the world. The numbers are down almost 50% since 1970. And it's a crisis related to our diet, exercise, our food sources, chemicals in our environment, and overall wellness. And so what we're seeing is the quality and the quantity of sperm in men these days is not as good as it was decades ago.
What does that mean to have low quality sperm?
When you look at sperm under the microscope, you're looking at millions and millions of swimmers or sperm. And we want to know not only are they healthy, but can they swim? Can they swim in the right direction? Are they healthy sperm? Are their heads and their tails healthy? And when we put that all together, it's called a semen analysis study. And that tells us how fertile a man is. And all of the factors about a man's lifestyle, their genetics, previous medical conditions, surgeries, their lifestyle, their diet, they all come into play over the first 18 to 35 years of life, leading to the health of a sperm. And so when we look at a sperm sample under the microscope, we can really determine how healthy that man is based upon how healthy their sperm is.
The couple is trying to conceive. What would be a good time frame if they're not having any luck? When should they see somebody? When should the man see a urologist? When should the woman see a fertility specialist? Are we talking months, a year? What do you think?
Well, sooner rather than later. However, all couples will experience some difficulty with achieving pregnancy. And it's not abnormal for couples to take a few cycles with the female, 3 months, 6 months to achieve it. But if you're having difficulty achieving and it's been 6 months to a year, it's not unreasonable for the female to see her OBGYN and for the male to see his urologist to get a workup. Now, the one caveat to that is age, right? So if you're an older couple, we don't want to wait too long. So if you're getting into your mid to late 30s, early 40s, and you're having difficulty, then right away is the right time to see your practitioner.